cognitive behavioral therapy, or CBT, is akin to a guiding light in the intricate maze of our minds. It offers valuable insights and tools to navigate the labyrinth of thoughts and emotions, steering us toward clarity and well-being. This guide gives you an understanding in order to effectively advocate for yourself with future therapists. CBT is grounded in the belief that our thoughts, feelings, and actions are interconnected and that altering them can enhance our mental well-being. CBT relies on more than evidence. It also applies functional analytic principles to understand why people behave the way they do and what happens. The therapist collaborates with the client to develop a shared conceptualization, goals, and interventions, encouraging them to take a hypothesis-testing stance regarding their issues. They use social learning to help people improve their social support networks and learn effective coping strategies that have worked for them in the past. The tailoring allowed in this intervention fits each person's situation, benefiting the Black community. If no adjustments are given in CBT, it can create limitations for the Black community. Eurocentric views may cause therapists to overlook or minimize the impact of racism and prejudice on the mental well-being of the Black community. It can reinforce stereotypes shaping a negative perception of their lives. Additionally, it may prioritize logical thinking over spiritual and emotional aspects important for African Americans. The evidence for CBT may not always fully apply to Black communities since it was not tested with them in mind. However, similar to trying to find your way through a maze without considering the cultural aspects of CBT, therapists need to understand how important the community is in a therapy session for it to be successful. This aspect must be addressed as therapists concentrate on individualism. There are 4 main ways that CBT can be adjusted. Step 1. CBT therapists need to address stigma by creating a safe and non-judgmental therapeutic environment that promotes awareness and education on mental health issues. Step 2. CBT can use idiographic assessment data, using personalized assessment information relevant to the individual's needs. Step 3. CBT benefits the Black community because clients are seen as experts on themselves and their challenges, while the therapist is an expert on the treatment. Step 4. Tools and support such as clients learn to spot signs of continuous progress and try out behavioral tests to question their mistaken beliefs. They also work on confronting negative assumptions and internalized racism while building a strong sense of pride in their racial or ethnic background. When considering a solution to cultural competence questionnaires that assess racial identity, acculturation levels, and Afrocentricity are essential. These questionnaires provide valuable insights into individual differences and the extent of involvement in ethnic traditions and mainstream American culture. Focusing on broader external factors can reduce defensiveness and improve therapist comprehension, leading to more effective collaborative problem-solving. White therapists, like all members of society, may not be unaffected by the racial biases passed down through generations. Research has shown how racism, prejudice, and stereotypes can affect the psychological well-being of Black community individuals seeking services. These are things to think about when choosing CBT with them. Before we close, here are some things to remember. Efficacy. CBT is effective in treating depression, anxiety disorders, post-traumatic stress disorder, and eating disorders. It is one of the most evidence-based and effective forms of psychotherapy. CBT focuses on the present moment and helps individuals identify and change negative thought patterns and behaviors, creating healthier coping strategies. The therapist and client collaborate to identify and address specific goals to give clients a sense of control over their mental health. Time-limited. CBT is cost-effective and accessible, ranging from 6 to 20 sessions, depending on the individual's needs and the nature of their difficulties. Skill building. CBT provides long-term practical skills, including identifying and challenging negative thoughts, problem-solving, relaxation techniques, and behavioral activation. I hope you enjoyed today's video and found it super informative.